can go ahead and start. So something actionable that I myself have done to try to, I think, make us not so invisible in the data. And I think one way to do that is to participate in research. My lab, we do a lot of projects across multiple different population groups, different races and ethnicities. And I hate to say it, but Asian Americans have one of the lowest response rates. We're considered, the term is hard to reach. We're not hard to reach, we're right here. And I know we as researchers probably need to do a better job. This is why we partner with folks like my colleagues here and with communities. But if we're not representing ourselves in the data, the research is based on that data used to inform clinical practice guidelines that clinicians like Elaine and Jane use to advise their patients. Those data don't represent us. So I think participating in research. The second thing that I would say that has personally been a struggle for me, but I see sort of small cracks in the armor, is just talking about it. In my family and my extended family, the cancer is still very much a stigma. We just don't talk about it. And when you don't talk about it, what happens? You don't get the sense that this is a problem that affects us. I can tell you a story about my grandmother. Apparently we learned much later on that she was diagnosed with some kind of cancer in the GI, the gastrointestinal tract. We don't know specifically what it was. Her diagnosis was never disclosed to her. She never even knew she had cancer because they didn't want to upset her. They didn't tell the whole rest of the family until after she had passed. Multiple examples of this. So when it's not openly discussed, again, there's a sense that it's not a problem that affects us. So I would just encourage us to have these conversations around the dinner table. I think oftentimes we have a lot of younger, really motivated, super smart interns, we call them our ambassadors, who are going to senior centers and going to churches and having these conversations with their older communities. And I just think that is so powerful.
That theme came up a lot when we were prepping, like why the silence? And how do we reframe that Confucianism or that shame into empowerment?
So I wanted to add what Scarlett said. Maybe I recently received emails and things in the mail asking me to join the American Community Survey, which is done by the US Census. And so you may have received that and maybe discarded it. But actually a lot of that data on a national level leads to allocation of resources. And so if we are not counted and you're not in that data, that there's no proof or evidence that we need resources. So I say at every single level, including voting, which I think is a very important thing, also affects your health and your ability to access healthcare. I think, from the clinical perspective, being a primary care doctor, I think one thing is you want to be able to find and assemble a care team of different clinicians that are for your specific situation that literally and figuratively speak your language. So you want to find someone that understands where you're coming from, is interested and curious about what you have to say, because you're experts of your own health, right? And you want to find someone that respects that. And I'm not saying you should go shopping around for different doctors, but you want to give time and try to get to know, see if this person you feel like you can work with to develop that. I think sometimes we view medical care as very transactional. In some level it is, but I think there's a lot of heart and personal relationships that go with that. And I think sharing that information, thinking if you can build that relationship with your clinical care team, will help you attain health, help you achieve some of the things that you want to do to improve your health, maybe improve the situation for your family. Maybe you're worried about certain things that run in your family. So I think definitely, literally and figuratively, find a clinical team that speaks your language.